Paul Levy, you're running a hospital in Boston. What credentials did you have to run that an organization?
Well, I had a lot of management experience, but really very little to do with the health.
Management experience in what?
Well, in a number of ways. I'd run the water and sewer agency in Boston. I'd regulated utilities, and I'd been administrative dean at Harvard Medical School.
What is the same about a sewer system and a hospital?
There's not a lot in common, but the one thing two things that are in common. First, we're both in the public health business, trying to protect the public. The second is when you run a sewer business and when you run a hospital, you don't know what's going to come in any given day, either the quality or the quantity. So you have to be adaptable. And also, with what you discharge or actually, discharge is the right word for both sewage and for hospitals. You have to meet very high standards.
So there's a common thing. Okay, you came to a hospital which had huge losses and which also had lots of problems. And what kind of things have you done with your management experience within hospital?
Well, when I arrived, the hospital was in deep financial trouble, and most of what we did at the time had to do with simple business steps to get it healthy again in terms of personnel and purchasing and the like. Once we get that done, then we could really focus on quality and safety improvements in our hospital. And we've been doing that quite a lot with the belief that not only is it good for our patients, but it's also good business. That if you can deliver better medical care, it's less expensive medical care.
You run a blog, howtorunahospital.blogspot.com, if I say it correctly.
Not quite right.
Okay. What's the name of your blog?
The blog is called Running a Hospital. You can find it on www.runningahospital.blogspot.com. Or if you forget the name, you can just do a Google search for Paul Levy running a hospital.
So you have basically started a blog, and you started to publish all kinds of statistics and numbers and facts about your hospital, which upset a lot of people inside the hospital and outside the hospital. How did that work out?
Actually, the people in the hospital were not upset, but the people around town in other hospitals were, because they thought it put them in a bad light. What we were trying to do is demonstrate to the public that we are willing to be held accountable for quality and safety improvements and establish metrics by which we'll be measured and to publish our results. I think it's a good thing to do. It also gives a signal to the people in the hospital that they will be held accountable, and maybe they work a little bit harder just because they know that.
They're being watched, but they thought it was a sensible tension. It was not Big Brother watching you.
The people in our hospital enjoy the fact that these numbers are posted publicly because they're very proud about the work they've done. They would like the world to know, and they also don't mind being held accountable.
Okay. So you would say that innovation in that subject we're talking about today, that transparency, showing what you're doing, putting people accountable, put it outside there on the web for everybody to see and to basically measure. Is that one of the first things you did to improve innovation?
Well, it's interesting to think about disclosure as a type of innovation, but it really is. Transparency, particularly in the medical field, is pretty unusual for reasons that I don't quite understand. But our decision to go public with all that information, I think, is viewed as an innovation in the field in the United States, and has produced some very important results, I think.
Other things, new techniques, what are the main innovations which you brought in the last couple of years?
Well, we've done an awful lot in our information systems, our computer systems, in terms of computerized order entry for drugs and for tests, and likewise electronic medical records, medicine reconciliation, so that when a patient shows up, the doctor pushes a button and all of the prescriptions that patient has from any pharmacy in America show up on the screen immediately. Those kinds of things are pretty important.
Can you do that as a hospital alone, or is that more a nationwide system?
Well, we designed it first for our hospital, but we're making it available to everybody. And but a lot of what we do is not particularly innovative. It's taking proven concepts of safety and quality, sometimes from other industries, and applying them in a hospital setting. And it's just a matter of wanting to do it and then measuring the results and holding yourself accountable.
You've now got to know our system a little bit. You have been a full 2 days here in the Netherlands. What is your impression about our system?
Well, I think the system in the Netherlands, like most healthcare systems, comprises very well-intentioned people who really have a calling, who believe in helping the public stay healthy or get healthy. And that's a wonderful thing everywhere in the world. It's been my experience that most of the health systems around the world are facing the same problems, which is to say increasing costs because of the demographics that we all face with the baby boomer generation, our parents' generation, and the like, with a lot of pressure on the cost side of the equation. So whether it's government financing or private financing of healthcare, we have to figure out a way to be smarter about how we deliver it. And my view is that if we get better at quality and safety, we'll also help control the cost increases.
So you think that better healthcare is cheaper?
Better healthcare is more economical. I don't think I'd ever use the word cheaper. I think it offers a way to control the increase in the cost of healthcare.
Okay, so that's the second biggest innovation. First is open, and secondly, you basically you create better healthcare, and then you reduce costs, so you're able to have the democratic monster to conquer that. How did you, when you did a lot of IT, did you have a particular love for IT or knowledge about IT, or how were you able to innovate, or was that the team which was there?
Well, it turns out we have the world's best chief information officer in the healthcare world, a fellow named Dr. John Halamka, who's both an expert in IT but also an emergency room doctor by training. And so he knows not only how to get programs written and applications ready, but how to work with the medical staff to make sure they're actually used when they're put in place. So
you have a CIO, which is also a medical doctor, which really can also put systems into practice.
That's right. It's a pretty unusual combination, actually. So I consider myself very lucky that we have that.
Okay. Well, thank you very much.
Pleasure.
That was a good third one. Get a CIO.